If you are over 60, what I am about to reveal will shock you. After interviewing hundreds of healthcare workers, I have uncovered the disturbing truth about what doctors really think when treating seniors. These 5 ugly realities are costing you proper care, respect, and potentially years of your life. One retired physician called it the healthcare industry's worst-kept secret. Do not let another medical appointment pass without knowing what is really happening behind closed doors. This could save your life. Welcome to Senior Wisdom. What you are about to learn will fundamentally change how you approach healthcare forever. Today, I am exposing 5 brutal truths about medical ageism that the healthcare establishment desperately wants to keep hidden from seniors. Here is your roadmap. Number 1. The shocking mental shortcuts doctors use the moment they see your age on the chart. Number 2. The disturbing economic calculations happening during your treatment decisions. Number 3. Why your symptoms are being filtered through dangerous stereotypes. Number 4. The prescription practices specifically targeting older patients. And number 5. The most heartbreaking assumption about your cognitive abilities that is affecting your diagnosis quality. But here is the empowering part. I will reveal the exact strategy successful seniors use to flip these dynamics and command premium healthcare. If you have ever felt dismissed, rushed, or talked down to by medical professionals, this conversation will arm you with the tools to never experience that again. Reality number 1. The label of complicated. They mentally label you as expensive and complicated before you even speak. The moment you walk into a medical office, your age triggers an immediate mental calculation in your doctor's mind. Healthcare professionals are trained to assess resource intensity, and seniors automatically fall into the high-maintenance category. This is not always malicious. It is systematic programming that shapes every interaction you have. Dr. Sarah Henderson, a former emergency room physician who now advocates for senior rights, revealed the disturbing reality. Medical schools teach efficiency protocols that pre-categorize patients by age groups. Seniors are assumed to require longer appointments, more tests, and complex medication management. This creates an unconscious bias before the examination even begins. The financial pressure intensifies this bias. Insurance reimbursements are declining. Patient quotas are rising. Doctors feel economic stress when treating older adults. Your comprehensive health needs often clash with their limited time. And honestly, that creates resentment that can affect the quality of care you receive. Research has shown that doctors spend about 23% less time actively listening to patients over 65, compared to younger patients with the same symptoms. Eleanor's story. Let us consider what happened to Eleanor, a 74-year-old retired teacher. She walked into her appointment with a carefully prepared notebook. She had tracked every symptom for weeks. But before she could even finish her first sentence, the doctor cut her off with the words, "Let us focus on your main concern today." Eleanor tried to explain that her symptoms were connected. The physician sighed and said, "We need to prioritize." Her chest pain was brushed aside as simple anxiety. That mistake delayed her heart diagnosis by half a year. This so-called complexity aversion goes beyond managing time. Many doctors shy away from ordering comprehensive tests for seniors. They assume the results will uncover multiple issues requiring long treatment plans. Rather than dig deeper, they treat surface symptoms and move on. The psychological impact is devastating. When a healthcare provider approaches you with preconceived ideas about difficulty and cost, they are less likely to collaborate. Instead, they stick to standard protocols for typical senior issues. Your unique situation gets ignored. Defense strategy number 1. So how do you combat this bias? Start every appointment by stating your measurable health goals. Do not just say, "I feel tired." Say, "My energy has decreased by 40% over 3 months, and I want to identify the cause." Bring a 1-page health summary. Show improvements you achieved with past treatments. Present yourself as an active participant, not a passive recipient. Request specific time frames for deeper conversations. You could say, "Doctor, I know today is short. Can we schedule a 30-minute appointment next week to discuss my cardiovascular concerns?" This shows respect for their time while demanding proper care. Document everything. When doctors see you taking notes, they know you are paying attention. This subtle accountability changes behavior. Many use what we call polite medical gaslighting, dismissing symptoms as normal aging. Your notes hold them to a higher standard. Reality number 2. Medical gaslighting. Medical gaslighting has become so common that many healthcare providers do not even realize they are doing it. When doctors attribute legitimate symptoms to normal aging, they use a socially acceptable form of discrimination. It delays diagnosis. It delays treatment. Dr. Michael Torres, a geriatrician who spent his career fighting ageism in medicine, explained it this way. The phrase, "you are getting older," has become a medical cop-out. It dismisses symptoms that would trigger immediate investigation in younger patients. This is not evidence-based medicine. It is age-based assumption. Harold's story. Harold, a 67-year-old former mechanic, complained for 8 months about joint stiffness and fatigue. Every visit ended with the same line. "Harold, you are not 30 anymore. Your body is slowing down." When he finally insisted on blood work, the results showed severe rheumatoid arthritis. The delay meant joint damage that could have been prevented. Gaslighting follows predictable patterns. Doctors say, "At your age, that is expected." Or, "We all slow down." They redirect away from serious investigation. They suggest generic advice like more exercise, better sleep, or less stress. Meanwhile, the underlying condition worsens. Women face a double burden. Symptoms are dismissed as both aging and hormones. Men are told their changes are just normal male aging. Mental health concerns are brushed aside as life stage transitions. The result? Seniors begin doubting their own judgment. If an authority figure repeats, "This is normal," you start questioning your own reality. Self-doubt delays care. Outcomes get worse. Defense strategy number 2. Here is how you fight back. When your doctor says, "That is normal for your age," respond with evidence-based questions. What percentage of people my age experience this exact symptom? What studies support that this level of symptom is typical? Build a timeline of symptoms. Do not just say, "I feel tired." Say, "Until March 15th, I had stable energy. After that date, I needed daily naps for the first time in my life." Ask directly, "What tests would you order if I were 40? This forces providers to confront age bias. Use escalation language. "Doctor, I know aging affects energy, but this is a sudden change from my baseline. I am concerned about an underlying condition. What diagnostic steps can rule this out before we call it aging?" And whenever possible, bring an advocate. Another voice in the room helps capture details, ask follow-up questions, and keep the conversation accountable. This is just the beginning. Eleanor's delayed diagnosis, Harold's ignored arthritis. These stories are not rare. They are warnings. What is coming next will take us deeper into the realities of medical ageism. We will examine how doctors quietly calculate your value, why medications are used as control rather than care, and how assumptions about your mind steal treatment options. And most important, I will show you how to flip these patterns, demand dignity, and secure the care you deserve. Reality number 1 expanded. The label of complicated. The first ugly reality is this. Doctors mentally label you as complicated, expensive, and difficult the moment they see your date of birth. This label is applied before you even open your mouth. It is not personal, it is a reflex. It is built into the way medical training works. Hospitals run on efficiency protocols. Clinics run on quotas. Insurance companies reward speed. And older adults, people over 60, 70, or 80, are seen as the opposite of quick and easy. The system programs doctors to see you as time-consuming, resource-draining, and yes, complicated. How this bias shows up. Let me break it down. Number 1. Appointments are shorter. Studies prove doctors cut visits shorter with seniors. You get less eye contact. You get interrupted more. Number 2. Testing is limited. Doctors avoid ordering full diagnostic panels. Why? Because results might reveal multiple issues, which means longer treatment plans. Number 3. Communication is shallow. Instead of asking open questions, doctors jump to standard senior checklists. Blood pressure, cholesterol, arthritis pain. This bias is not about your health. It is about their time. George's story. Let me introduce George, a 68-year-old retired engineer. George noticed recurring shortness of breath when climbing stairs. He asked his doctor for a stress test. The doctor shook his head and said, "George, that test is intense and may not be appropriate at your age. Let us just monitor for now." 3 months later, George collapsed in his driveway. The hospital found a blocked artery. The procedure that saved his life should have been done months earlier. George's case shows how the complicated label leads to dangerous delays. His doctor was not cruel. He was busy. He assumed George was too old for aggressive testing. That single assumption almost cost George his life. The psychology behind it. Doctors are not always aware of this bias. Here is what happens in their minds. Step 1. They see your chart. Age over 65. Step 2. They remember training. Seniors equal longer visits, more meds, higher risk. Step 3. Their brain takes a shortcut. This patient will drain time and resources. Step 4. They act accordingly. Shorter visits, fewer tests, quicker decisions. This is not evidence-based medicine. It is age-based stereotyping. The emotional impact. Being labeled complicated changes more than your treatment. It changes how you feel. You sense the size. You hear the interruptions. You notice the lack of patience. Eleanor, the retired teacher we spoke about earlier, described it this way. "I felt like a burden before I even said hello." That emotional weight makes many seniors stay quiet. They hold back details. They accept less care. They shrink inside the very system that is supposed to heal them. Defense strategy number 1. Take control early. So how do you fight back against the complicated label? Step 1. Lead with goals. Begin your appointment with a clear statement. "Doctor, I want to improve my walking distance by 1 mile without pain." Or, "I want to reduce my blood pressure by 10 points in 6 months." When you present goals, you frame yourself as focused, not complicated. Step 2. Prepare your health snapshot. 1 page. List your current medications, key health changes, and recent test results. Hand it over before the doctor even asks. This saves them time. More important, it shows you are organized. Step 3. Document in real time. Take notes on paper or a tablet during the visit. Doctors notice. They know you are watching closely. That shifts their attention. They explain more clearly. They treat you more seriously. Defense strategy number 2. Respect time, demand time. Doctors often feel rushed. You can respect that while still demanding proper care. Try this line. "Doctor, I understand today is limited. Can we schedule a longer visit to cover my cardiovascular concerns?" This shows you value their schedule. It also makes clear your issues need time. When you balance respect with firmness, you change the dynamic. The doctors stop seeing you as complicated. They see you as a partner. Defense strategy number 3. Frame yourself as a partner. Healthcare works better when it is collaborative. But many doctors unconsciously treat seniors as passive recipients. You flip that by using phrases like, "I want to work with you on a plan. Here is what I have already tracked. Let us set measurable outcomes together." Partnership language makes you harder to dismiss.
A hidden benefit here is something you might not expect. When you approach doctors this way, they often feel relieved. Many want engaged patients. Many feel drained by passivity. By being clear, prepared, and proactive, you reduce their hidden resentment. That improves the care you receive. Closing page 2. Reality number 1 is harsh. The complicated label damages trust, delays treatment, and endangers lives. But you are not powerless. With goals, preparation, documentation, and partnership, you can erase the complicated label from the first minute of every appointment. Remember George. He almost lost his life because his doctor assumed he was too old for testing. Do not let assumptions decide your fate. On the next page, we will dive into reality number 2, the subtle but dangerous world of medical gaslighting. You will learn why doctors dismiss symptoms as just aging, and more important, how to demand the investigation and care you truly deserve. Reality number 2, medical gaslighting. The second ugly reality is this. Doctors often dismiss your symptoms as nothing more than aging. This is called medical gaslighting. And it has become one of the most dangerous habits in modern healthcare. Here is what it sounds like. At your age, that is normal. We all slow down eventually. It is just part of getting older. Simple phrases. Harmless on the surface. But beneath those words is a form of discrimination that costs seniors precious months, even years, of health. Why this happens? Medical gaslighting happens because of shortcuts. Doctors are taught to connect age with decline. When you say you feel tired, their mind jumps straight to aging. When you mention pain, they frame it as arthritis. When you describe sadness, they call it life adjustment. Instead of investigating, they label. Instead of testing, they excuse. Dr. Michael Torres, a respected geriatrician, puts it plainly, the phrase "you are getting older" has become a medical cop-out. It shuts down investigation before it even begins. The numbers researched by the American Geriatrics Society is chilling. 85% of serious conditions in seniors are first attributed to aging before a correct diagnosis is made. That means nearly 9 out of 10 seniors with a real medical issue hear, "This is normal for your age," before anyone runs proper tests. Imagine the delay. Imagine the damage. Harold's story. Take Harold, a 67-year-old former mechanic. For 8 months Harold complained of joint stiffness and deep fatigue. He visited his family doctor over and over. Every time the response was the same: "Harold, you are not 30 anymore. Your body is slowing down. This is expected." Finally, Harold demanded blood work. The results were clear. Severe rheumatoid arthritis. 8 months of untreated joint damage. Harold was furious. He said, "If I had been 40 years old, they would have tested me the first month. But because I was 67, they wrote it off as age." His anger is justified. Those 8 months of dismissal changed his body permanently. The emotional damage. Medical gaslighting does more than delay care. It damages confidence. It makes you doubt yourself. If a doctor repeats "this is normal" enough times, you start to wonder, maybe I am imagining things. Maybe I am overreacting. Maybe I should just accept it. That self-doubt is dangerous. It stops you from pushing for answers. It silences your own experience. Women often suffer this twice over. Their symptoms are blamed on aging and on hormones. Men too are dismissed, fatigue or mood changes written off as male aging. Mental health gets brushed aside as well. Depression, anxiety, or confusion is waved away as a natural stage of life. The truth. These are real conditions that deserve real treatment. Defense strategy number 3, ask for evidence. So how do you fight medical gaslighting? You demand evidence. When a doctor says, "That is normal for your age," respond with, "What percentage of people my age experience this specific symptom? What research supports the idea that this level of pain or fatigue is typical?" Most of the time, they cannot answer. Because they are speaking from assumption, not science. Defense strategy number 4, use timelines. Symptoms dismissed as aging can be reframed with clear timelines. Do not say, "I am more tired lately." Say, "Until March 15th my energy was stable. Since then, I require daily naps for the first time in my life." Do not say, "My knees hurt." Say, "For 20 years I climbed stairs with no problem. Last month I began struggling after only 10 steps." Timelines show change. Change means something is wrong. And change cannot be dismissed as just aging. Defense strategy number 5, ask the age question. One of the most powerful tools is this question: what test would you order if I were 40 years old with these same symptoms? This forces doctors to reflect. It shines a light on their bias. Many times, they will adjust and order the tests you need. Defense strategy number 6, escalate with clarity. When you feel dismissed, speak with firmness. Say, "Doctor, I understand aging affects energy, but this represents a major change from my baseline. I am concerned this signals an underlying condition. What diagnostic steps can we take before assuming this is aging?" Polite but direct. Respectful but firm. Defense strategy number 7, bring an advocate. Finally, do not go alone. Bring a spouse, a child, a friend, or even a neighbor. Another voice in the room prevents subtle gaslighting. They can ask questions you miss. They can write down details. They can hold the doctor accountable. Doctors act differently when they know someone else is listening. Closing page 3. Medical gaslighting is not just words. It is delayed diagnosis. It is untreated disease. It is unnecessary suffering. Harold's lost months are proof. 8 months of pain. 8 months of preventable damage. All because someone said, "You are just getting older." Do not accept this. Do not let anyone wave away your health with a cliché. Demand evidence. Present timelines. Ask the hard questions. Bring advocates. On the next page, we will uncover reality number 3, the quiet but devastating assumption that seniors cannot understand complex information. This hidden bias robs older adults of advanced treatment options. And I will show you exactly how to break it. Reality number 3, the assumption of cognitive decline. The third ugly reality is this. Doctors often assume that if you are over 65, your mind is slipping. They believe you cannot handle complex explanations, you will not follow detailed treatment plans, and you are better off with the simplest option available. This bias is subtle. It does not always sound insulting. But its impact is massive. What it looks like. Here is how it shows up. Number 1. Doctors slow their speech and use overly simple words, even if you have a graduate degree. Number 2. They skip advanced treatment discussions because they assume you cannot process details. Number 3. They default to simpler medications that are less effective, but easier to take. Number 4. They avoid offering new technology tools, assuming you cannot use them. These assumptions steal options. They limit your choices. They rob you of the same opportunities younger patients receive. Patricia's story. Meet Patricia, a 71-year-old retired accountant. Patricia was diagnosed with early-stage breast cancer. Her oncologist quickly recommended a basic mastectomy. He did not mention reconstruction options. He did not explain targeted therapies. He did not bring up clinical trials. When Patricia pressed for details, the doctor said, "At your age, we want to keep this simple." Patricia was furious. She had spent her career managing complex financial portfolios worth millions of dollars. She was more than capable of understanding medical details. After months of pushing, she finally gained access to the same advanced therapies routinely offered to women half her age. Her story proves this bias is real and dangerous. The cycle of underestimation. Doctors underestimate seniors' cognitive abilities. That leads to simplified care. Simplified care often produces weaker results. Weaker results reinforce the idea that seniors cannot handle complexity. The cycle repeats. Over time, many seniors internalize these assumptions. They stop asking for details. They stop believing they can manage complex plans. They begin to think, maybe I really cannot handle it. That is the most tragic part. A false belief becomes a lived reality. Medication bias. Now let us talk medication. Doctors often choose once-daily pills for seniors, even if the more effective medication requires 3 doses a day. Why? Because they assume you cannot manage multiple schedules. The result? Less effective treatment. More side effects. Lower quality of life. It is not about what works best for your body. It is about what they think you can handle. Technology discrimination. The same thing happens with technology. Medical portals, digital reminders, health monitoring apps. Many doctors never even mention them. They assume seniors cannot or will not use technology. But the reality: millions of older adults use smartphones, tablets, and wearable devices every day. By ignoring technology, providers cut you off from tools that could improve your care, track your progress, and keep you connected. Defense strategy number 8: establish competence early. Here is how you fight back. Step into every appointment with a statement of capability. You might say, "I managed complex projects for 30 years. Please give me full details so I can make informed decisions." Or, "I research medical information regularly, so I want technical explanations of all my options." This sets the tone. It forces respect. Defense strategy number 9: ask for technical explanations. Do not settle for simplified talk. Ask, "Can you explain the pathophysiology of this condition? How does each treatment option address the underlying mechanism?" When you use precise language, you signal that you expect precise answers. Defense strategy number 10: bring evidence of engagement. Show that you are an active learner. Arrive with notes. Bring articles you have read. Reference questions from medical journals. This is not about showing off. It is about proving you are serious. Doctors cannot easily dismiss a patient who arrives with well-researched questions. Defense strategy number 11: demand equal options. If you are offered a simplified solution, ask, "What additional therapies would you recommend if I were 45 with the same diagnosis?" This simple question exposes bias. It forces doctors to consider if they are holding back treatment because of age. Defense strategy number 12: use technology publicly. Do not hide your skills. Open your smartphone during the visit. Pull up your health portal. Check drug interactions with an app. When doctors see you using technology with ease, they cannot deny your ability. Defense strategy number 13: request written documentation. Always ask for detailed written treatment plans. Say, "Please provide comprehensive notes on all my options so I can review and research them thoroughly." This puts you in control. It also proves you intend to engage at a high level. Closing page 4. Reality number 3 is painful because it strikes at dignity. The assumption of cognitive decline robs seniors of choice. It limits access to advanced care. It quietly tells older adults, "You cannot handle this." But you can handle it. Patricia proved it. She fought for advanced treatment and won. So will you. State your competence. Demand technical explanations. Use technology. Request documentation. Challenge simplified solutions. When you do, you send a message no doctor can ignore: my mind is sharp, my life is valuable, and I deserve full access to every option. On the next page, we will explore reality number 4: how medications are too often used not for healing, but for control. This is one of the most disturbing truths of all, and I will show you how to protect yourself from it. Reality number 4: medications as control. The fourth ugly reality may be the hardest to hear. Too often, medications are prescribed not to heal you, but to control you. Doctors, hospitals, and care facilities sometimes use drugs to manage behavior. They call it treatment. But in reality, it is chemical restraint. What this looks like. Here is how it works. Anxious patients are given sedatives. Assertive patients are given mood stabilizers. Seniors who ask too many questions are given antidepressants. These drugs are not always prescribed because of real medical conditions. They are prescribed because they make patients easier to handle. Dr. James Martinez, a former nursing home medical director, said it plainly. "I saw countless cases where medications were used to reduce staff workload, not to improve patient health." The numbers. The statistics are shocking. Over 40% of seniors are prescribed at least one psychiatric medication. But only 12% have an actual diagnosed mental health condition that requires it. That means the majority are medicated for convenience, not necessity. Linda's story. Meet Linda, a 69-year-old community volunteer. Linda had hip surgery. She was determined to recover quickly. She asked questions about every step of her rehab plan. Her medical team grew impatient. They labeled her difficult. Instead of addressing her concerns, they prescribed anxiety medication to help her relax. But the drug caused confusion and dizziness. Within a week, Linda fell and broke her wrist. Her recovery stretched 4 months longer than it should have. The medication meant to calm her actually created new injuries. The double danger. This practice is dangerous in 2 ways. Number 1. It introduces new risks. Sedatives increase the chance of falls. Mood stabilizers dull alertness. Sleep aids disrupt natural cycles. Number 2. It masks real problems. Confusion caused by sedatives gets mislabeled as dementia. Apathy from mood stabilizers gets called depression. Sleep disturbances from pills are treated with more pills. The medication itself becomes the problem. Why this happens? There are several reasons. Hospitals prefer quiet patients. Care facilities prefer compliant residents. Insurance companies prefer cheap pills over expensive therapies. Families sometimes prefer medication because it is easier than dealing with emotional distress. The system rewards quick fixes, even if they are harmful. Other misuses. It is not just psychiatric drugs. Seniors are often denied proper pain medication. Providers assume they are exaggerating or drug-seeking. Blood pressure medications are sometimes given at doses that cause dizziness, making patients less likely to complain or resist. Even normal sleep changes in aging are treated with heavy sleep aids instead of lifestyle adjustments. The pattern is the same: control first, care second. Defense strategy number 14, ask the purpose. So how do you protect yourself? Start by asking 3 questions before accepting any prescription. What specific condition does this medication treat? What objective measurement will show it is working? How will we know when to stop? If clear answers are missing, pause. Do not accept vague phrases like to calm you or to help you sleep. Defense strategy number 15, demand treatment goals. Every prescription should have a measurable outcome and a timeline. Say, I want to know the goal for this medication. If I do not see results in 30 days, I want to revisit the plan. This prevents open-ended prescriptions that continue for years without review.
Defense strategy number 16, independent reviews. Ask for a medication review by a pharmacist or a geriatric specialist. These experts often catch unnecessary drugs, dangerous interactions, and overprescribing patterns that primary doctors miss. Independent eyes can save your health, and sometimes your life. Defense strategy number 17. Establish a baseline. Before starting any psychiatric or mood-related medication, get a baseline record of your cognition, balance, and mood. That way, if new problems appear, you can prove they are drug-related, not natural decline. Defense strategy number 18. Explore alternatives. Many behaviors that trigger prescriptions can be addressed without drugs. Agitation may come from environment stress. Sleep issues may improve with routine changes. Anxiety may ease with therapy or social support. Ask, what non-medication options exist? What lifestyle changes or therapies can we try first? Defense strategy number 19. Build a support network. If medication ever dulls your judgment, you need someone ready to step in. Choose an advocate, a spouse, child, or trusted friend, who will question medical decisions and ensure your wishes are respected. Closing page 5. Reality number 4 is disturbing because it replaces healing with control. Linda's broken wrist was not an accident. It was a direct result of unnecessary medication. But you are not powerless. You can ask tough questions. You can demand goals. You can seek independent reviews. You can document your baseline. Most of all, you can refuse to be medicated into silence. You are not a burden to be managed. You are a person who deserves respect, safety, and real care. On the next page, we will face the most heartbreaking truth of all. Reality number 5. Behind closed doors, doctors sometimes calculate your life's value. They weigh your years left against the cost of treatment. And I will show you how to fight back against this cruel arithmetic. Reality number 5. The value of your life on paper. The fifth ugly reality may be the most heartbreaking of all. Behind closed doors, many doctors are taught to calculate your life's value before recommending treatment. They use formulas, they use numbers, and those numbers often reduce your worth simply because of your age. The economic formula. One of the most common calculations is called Quality Adjusted Life Years, or QALY. Here is how it works. A younger person is assumed to have more years left. Those years are valued higher. An older person is assumed to have fewer years left. Those years are valued lower. So when doctors or hospitals decide whether to approve an expensive procedure, they ask, is it worth it for someone at this age? This is not about your health. It is about cost versus years. George's story. Let us return to George, the 68-year-old retired engineer. When George was diagnosed with kidney failure, his doctor suggested palliative care. Dialysis was mentioned but discouraged. The explanation was simple. At your age, it may not be appropriate. But George refused to accept that answer. He fought. He demanded second opinions. After 3 months of persistence, he finally started dialysis. And here is the truth. With treatment, George lived 7 more years. 7 active, productive years filled with family, projects, and travel. 7 years the system wanted to deny him.
The silent impact this value calculation influences more than major treatments. Seniors are often denied expensive imaging tests, like MRIs or CT scans, because the benefit is considered too short-term. Preventive screenings are cut off at certain ages, even when individuals are healthy enough to benefit. Mental health services are withheld, framed as unnecessary at this stage of life. The result: older adults receive less care, not because of medical reasons, but because of actuarial math. The emergency room bias. You can see it most clearly in emergency rooms. 2 patients arrive with the same symptoms, one is 40, one is 70. The younger patient receives more tests, a longer exam, and often a hospital admission. The older patient is checked quickly, given basic medication, and sent home. Emergency physicians admit age plays a role. They are pressured to conserve resources. Seniors are often the first to be cut short. The family pressure. There is another layer. Doctors sometimes frame age-based denial as kindness. They tell families, aggressive treatment would be too hard at this age. Comfort measures may be best. Families, not knowing the full picture, often agree. They believe they are protecting their loved one, when in reality they are accepting discrimination. The emotional toll. Over time, seniors internalize these judgments. They stop asking for advanced treatments. They stop believing they deserve the best care. They say, I have lived long enough, maybe it is time to give up. But those words are not born from personal choice. They are shaped by a system that quietly devalues older lives. Defense strategy number 20, ask the age question again. When a doctor suggests comfort care or denies treatment, ask directly. Would you recommend the same plan if I were 45 with the same condition? This forces them to explain the real reason for their recommendation. Defense strategy number 21, bring evidence. Research treatment outcomes for people your age with your condition. Show studies where seniors recovered well, benefited from therapy, or lived longer after surgery. Walk into the office with data in hand. Doctors respect evidence. Defense strategy number 22, seek specialists. General practitioners often default to age-based limits, but geriatric specialists understand that many seniors respond very well to advanced treatments. Get multiple opinions. Do not stop with the first no. Defense strategy number 23, use legal advocacy. Age discrimination in healthcare violates federal laws. If you are denied treatment based solely on age, you can appeal. Senior advocacy groups and legal organizations exist to help you. Do not hesitate to use them. Defense strategy number 24, document discrimination. Keep records of what doctors say. If a provider openly mentions age as a reason for withholding care, write it down. Documentation strengthens appeals and exposes bias. Your life has equal value. Here is the truth. Your life is valuable at 60, at 70, at 80, and beyond. The years you have left, whether 2 or 20, are not worth less than anyone else's. You deserve equal access to treatments, diagnostics, and therapies. Never let actuarial math decide your fate. Conclusion: the 5 ugly realities. Now you know the 5 ugly truths about medical ageism. Number 1. Doctors label you as complicated and expensive. Number 2. Symptoms are dismissed through medical gaslighting. Number 3. Assumptions of cognitive decline limit your options. Number 4. Medications are used to control, not heal. Number 5. Economic formulas devalue your remaining years. Each one is real. Each one is dangerous. But each one can be challenged. The power of advocacy. Remember Eleanor, whose chest pain was brushed aside. Remember Harold, who waited 8 months for a real diagnosis. Remember Patricia, who demanded advanced cancer treatment. Remember Linda, whose recovery was sabotaged by unnecessary drugs. Remember George, who fought for dialysis and gained 7 more years. Their stories prove a simple truth: advocacy works. Persistence matters. Every time you ask hard questions, you change the system. Every time you bring evidence, you force respect. Every time you refuse dismissal, you raise the standard for seniors everywhere. Do not think of this as just protecting yourself. Think of it as paving the way for every older adult who comes after you. Your health, your dignity, your years. They are too valuable to surrender to bias. So here is what I ask: share this episode with another senior you love. Comment below with your own experience of ageism in healthcare. Subscribe to Senior Wisdom so we can continue this fight together. You deserve medical care based on your unique health, not your birth date. And together, we can change healthcare forever.